Hello, this is Jim McGrew. I'm a veteran of the United States Navy. I'm also a person who spent a good number of years not utilizing the Veterans Benefits Health Care. And once my good friends pointed this out to me and I was able to find my way in the system, I found out how to work with it and how to help it work for me. There's a lot of information going around right now concerning the uproar with the scandals, if you want to call them that, concerning the Veterans Administration. Yes, there are misguided individuals who, for one reason or another, I'm not going to get into the politics of it, have created scheduling problems, and this has caused an uproar. However, there is access to veterans health care. The system is in good shape, and it does work for you. The main reason that works for me is because I use the My Healthy Vet website. I want you to notice in the upper left-hand corner here, that is the name, and it is myhealthyvet.com. Within that website, once you have gone through the process of, if you are a veteran and you do have access to veterans health care, you are entitled, and I use that word strongly, to the access to this website. There is a process to join. You have to check out who you are for your own safety and reading. So I'm going to show you some stuff, but I'm hopefully not going to show you any personal information on me. But I'm going to show you how this works. Once you have access to the website, you simply go and log in. And once you are logged in, at this point, you have a tremendous amount of information and features. You can schedule VA appointments. You can refill prescriptions. You can go to secure messaging, and I'm going to go more into that in a few minutes, and you can go to health living assessment. There are others. You have a VA facility locator, how to use the website, how to contact My Healthy Vet, which is the administrator of the page. You have the My Healthy Vet community. You can track your own health, for example. I'm going to click on that and show you that. I have access to my vitals and readings, which I'm going to go ahead and click on and show you. That basically my information is here from my previous sites, but at current I don't have it on here. Now I can go to my health history, and again, while I'm not going to show you my personal information, it is all here. My goals, my journals, labs and tests, it's all here. Now, it's not going to be here unless I go into into secure messaging, which is a much more private layer of this thing. But you can go, for example, into the pharmacy, and you can go into my medications and supplements, for example, which I have to self-enter those things. But if I go back to the my VA medication list, for example, it's going to, and I'm going to show you real quickly, my healthy system. Now, when I go to secure messaging, and this is where it gets really, really tight, and this is done for the protection of the veteran. At this point, you have to log in again separately by opening secure messaging. Now, once you've done that, you are then in an email safe, secure situation where you are contacting your provider and communicating with your provider through documented emails. You can print them, you can save them. They create a direct written line between you and your provider. This works for me. I have twice in the last couple of months had a prescription refill run out with before I was ready for an appointment. And I have scheduled appointments on this. I have discussed my health. You probably aren't going to get an email back in the next few minutes, but you are going to get one back. Now, this is not for emergency situations. This is for regular scheduling and regular communication about your health with your health provider. It concerns your appointments, your rehab, in my case, my knees, along with your prescriptions and appointments. Now, if you have an emergency health situation, any healthcare professional is going to tell you, just like the VA is, you call 911 and you go to an emergency room. If you can make it to the emergency room at the Veterans Hospital, you should. However, I wanted to make this simple video to let you know that there is access to veterans health care, and it is professional. This is a state-of-the-art website. I have been insured privately, and I have never seen anything this well done that concerns every veteran available in the United States of America. Please consider this. If you really want to be helpful to the veterans and to the country, you will grab a veteran who does not know how to use this, who is having trouble, anyone who is complaining about appointments. You will teach them how to get this site, get to it, and use it. It will work for you. I have not had any trouble at all. One more small thing. If you have an appointment with the Veterans Administration, remember, that's a moving target down there. Those people are working hard. They're friendly. They're polite. The janitors will stop and show you around and help you find your way around that building. You'll go and see people sitting in the lobby. Believe it or not, a lot of them are just socializing. Sometimes you have to stand in line to get your, if you have travel pay and those kind of things. But the most important thing you can do to help the situation is to show up for your appointments on time. You have to remember, they only got so many hours in a day. They line them up, and you're a part of it. If you do your part, you will be seen at the time you're supposed to be seen or shortly thereafter. I've sat in private doctor's offices for an hour, hour and a half waiting for the next guy to get out of the way when I was on time. That rarely has happened to me at the VA. However, I have sat in those lobbies and listened to an awful lot of veterans complain because they showed up late and now nobody can make time to see them. Well, guess what, folks? It's a system, and it has to work like a system. You were in the system when you were a veteran. You were in the system when you were in the military. We did what we did in service. We are entitled to this health care, but we're not. I don't believe for 1 minute that we are to demand that we are narcissistic in profile or to be placed at front on a personal whim. You have to do your part. This is one way this system does work for us. I hope you'll consider what I've said here. Take it to heart. But thank you very much for taking the time to listen to this. And today, go help a veteran.